Hi everyone, welcome to another episode on our YouTube channel. My name is Dr. Bisma. I'll be talking all things aesthetic. So today's topic, we're going to be looking at some recent transformations, celebrity transformations to be exact. And yeah, I think there's been a couple of really cool ones lately. I'm intrigued to see what the guys are going to show me today. Okay, so we're starting off strong with Lindsay Lohan. Wow, okay. I definitely remember her from the old school movies. She's grown quite a bit and, you know, she's still looking lovely as ever. She looks amazing though with her recent photos. So let's see, what do we think has been done as of recent? Well, from her photos, other than the obvious change in hair with the blonde hair, it really suits her. Honestly, it looks amazing, whoever her hairstylist is. And so what has she done aesthetic wise? I would say she's probably, you know, utilized a fair amount of non-surgical aesthetic procedures and maybe also a few surgical ones as well from what I'm seeing. Let's start off with, let's see. So I definitely feel she, like many celebrities before, had maybe underwent and taken on too much filler. I think she's dissolved everything and started again. So she doesn't have that really puffy appearance as she once did. I definitely think she's also lost some weight, so that might also account for the reduction in her face volume quite a bit, because her face looks a lot slimmer than it did before. That's one thing I've noticed. Her cheeks also, while still full, do not look as visibly big as they did prior to her recent pictures that have come out. What else has she done? She's definitely done something for around her eye areas and around her eyebrows for sure. Possibly like a facelift, I would say, maybe a surgery. Maybe she just had like a ponytail eyebrow lift as well, possibly, which would also be very undetectable as well. But she's definitely done something to lift up her eyebrows. It could have also been done with some very well-placed Botox as well. I definitely think she's done something around her eyes, maybe some blepharoplasty, upper and lower, possibly. I think definitely she did some lower blepharoplasty, or she's done a really good job with her makeup. Like, it's looking really good recently. What else are we looking at? Lips. I feel like she's definitely done something with her lips. I think she has gotten someone who's done a really good job with doing a very subtle amount of lip filler as well. And possibly some chin filler. Although again, it could be just a bit of weight loss. And I definitely noticed that she has much less visible lines on her neck. So it could be a possible face and neck lift as well, to be honest. Yeah, I would definitely say. So we're going on to the next person now. This is Donatella Versace. So let's have a look from her photos from very early on in the 80s. You see a very natural appearance. Don't think she's had anything done back then. Maybe a few skin procedures, if anything. 2014, we're starting to see a bit again of that puffy face that I was mentioning. The lips look like they have definitely been done in that photo. Definitely feel like there's been a lot going on around the cheeks as well. So I think definitely she's done quite a bit of filler. I see her forehead doesn't have any lines at all. She's definitely done some Botox there, for sure. And then we see her picture in 2024. I can see that her forehead has become quite smaller. So that might be pointing towards possibly two things: a hair transplant surgery, I think, or it could be that she had a forehead reduction surgery. I think it's more likely that she did a hair transplant based on what I can see. The volume of her hair looks much fuller, the density is quite there, so could be a hair transplant. Her eyebrows, again, look very lifted in this one, although it could also be that her makeup is just very differently done, because her eyebrows were sitting much lower on her face in 2014. So she could have had an eyebrow lift for sure. I definitely think she might have done a upper blepharoplasty as well. Her eyes definitely look much more open as well. I don't think she's touched her nose. Maybe done a bit to the tip just to get a bit of a lift. Maybe a small rhinoplasty. And apart from that, I do think what she has done is I think she's dissolved all of the filler from 2014 that she had done from her pictures back in 2014. I think she's dissolved everything and done it again, because I still sense that she might have some filler in the 2024 one, but it looks a lot less exaggerated. Again, I think she removed all her lip filler and again had it very well placed, so it doesn't look, it looks very subtle. And again, once more, I'm noticing that she has a reduction in the lines that you can visibly see on her neck. So again, a possible neck and facelift as well involved in this case as well. Okay, so the next one we're looking at is Christina Aguilera. Yes, okay, so you can see her in the 90s, very fresh faced. I don't think she's had anything done there. I haven't seen any pictures from before that. But then we look at the 2019 version. Again, we're looking at that really sort of puffy face. Again, I think it's a lot of filler that's just been a bit overdone. It could also be some possible weight gain as well. Because I remember she had put on a bit of weight back then. And now we're looking at her recent photos. Oh my God. She looks amazing. How old is she again? Is she in her, like,
30s,
40s? 30s or 40s? I wish I looked like that right now. And like, yeah, I want to know what she's done. Wow.
43.
She's 43, guys, 43. She looks stunning. I wouldn't say she's 43 at all. Yeah. So what has she done? I would definitely say she's definitely lost weight. I think she's, number one, she's definitely lost weight. And we're looking at then her jawline is looking a lot more snatched. That's one thing. Her jawline was not as defined as it was in the other one. And her neck also, again, not much visible lines, which is amazing. I think, again, she's done something, neck lift, possible procedures on her neck. Otherwise, like just skin revitalizing treatments like Morpheus or something like that. She's definitely done something on her neck. What?
Wait. Can you just wait?
Sorry, guys. We're filming in clinic, so yeah, you can hear everything. So, what we're looking at, I think.
Please, we're still filming.
We've got to make sure we have some space. So let's see. Let me have a think. I think, well, first of all, she's lost weight. Second of all, she's definitely done something with her jawline. I think she's definitely as well, like the rest of them, dissolved all the filler. And, oh, I can't see again. Yeah, she's definitely dissolved all the filler that she had before. Plus or minus, she's also lost weight. I think that's probably contributed, first of all, to the very sharp appearance. On top of that, she probably did something like a face or neck lift just to help give that extra oomph. And so, to recap, I think she's definitely dissolved all of the filler that she had previously, if she did any, and plus or minus, she's lost a good amount of weight as well, which has led to her having like a more defined jawline and more defined neck as well. No crepiness on the neck is visible. I think she might have also maybe done like some additional things, like very well placed filler in her case. I think she did some on the chin. I think she also did some on her cheekbones. She definitely maybe did some around her chin area as well. And I think she might have gotten an eyebrow lift, possibly. Yeah, that's what I would say. So what I can definitely see from looking at these celebrities so far is, you know, everyone is going for a more, like, we're moving on to that trend anyways, where you're looking at really undetectable procedures, which I think is great. I think we're moving away from the era we had before, where we were getting a bit of filler blindness or Botox blindness, and you know, we were doing a bit too much. Now we're moving back, we're looking at other procedures, we're combining things as well, which is the main thing. I did definitely notice with Lindsay Lohan as well, which I forgot to mention, is I think her skin was looking a lot better as well. So I think she's probably, like, I think a lot of celebrities as well are looking to improve their skin, not just add volume everywhere, so in their cheeks and their lips and everything. I think a lot of them are focusing on fixing their skin tone, texture, lifting their skin as much as they can, and basically just giving a more youthful appearance, but that's really undetectable. Like, it's not really... you'd really have to look at their photos to know, or compare them to their befores to actually realize what they've done. So yeah, I think one thing you can definitely take away from this is that there are a lot of non-invasive procedures available as well. So you can always combine surgery with non-invasive procedures as well to give you the best results. Now, non-invasive procedures that I think that a lot of people know about that are available are Botox and filler, which you can definitely do. There's definitely some indications for Botox. There's definitely some indications for filler as well. You also want to utilize things that help with, that are biostimulatory. So, you know, if you're looking at things like you have large pores or the beginning signs of fine lines, you want to look at maybe doing things like microneedling. If you want to get a bit of a non-surgical lift, especially for the neck and the lower face, you can do something like face tight, which is a really good option. Face tight and neck tight, which uses radio frequency, is a really good option as well. Skin tight, sorry. So yeah, so if you want to look at some really good options that are non-invasive, or things that you can incorporate alongside surgery, there are a lot of good options available these days. I think some of the most well-known non-surgical alternatives are Botox and filler, and Botox and filler definitely have their own indications. If you're looking for something like a bit more of a facelift, a jaw tightening kind of lift, or like a neck lift, you're looking at procedures like skin tight. Other than that, if your skin tight uses radio frequency, which again is a type of biostimulatory procedure, it helps to improve the skin laxity over time. The other thing you can do as well on top of this is to incorporate things like microneedling. Some really good microneedling you can get is such as the Morpheus 8, which incorporates microneedling with radio frequency. So that gives you that extra boosted lift and skin tightening effect that you're looking for as well. Really good to do all over the face. Again, it's non-surgical. The other things that you could also do on top of that is to incorporate the use of some really good injectables. So if you've got issues with like skin tone, large pores, pigmentation, you can also do a couple of different injectables, or even hydration levels. For example, you've got skin boosters, things like Profilo, which are pure hyaluronic acid, which we inject into the skin to boost hydration levels. Gives you a nice little plumping effect. The other things you can do, which are more innovative and new, you're looking at things like polynucleotides, which are really good, and you can do them as well in combination with things like microneedling and lasers. Yeah, I'm getting to that. I'm just being reminded what to mention in this video. So yeah, you can definitely do things like polynucleotides. You can definitely do things like Profilo to help boost the skin's hydration. Polynucleotides are very good for skin tone, anti-aging, a more useful appearance as well. They really help with collagen boosting as well. Other things you can look at are lasers. Lasers are really good to use in combination or by themselves as well. So one thing you can really use to help with any like more deeper, more stubborn fine lines, or if you've got like a lot of pigmentation which comes with age and a lot of sort of UV exposure, you can also use the Cyton resurfacing perfected. That's a really good thing to use. You can also use other lasers such as PicoShore to help remove pigmentation. If you have acne scarring as well, that's really good because acne scarring can give you less of a smooth appearance and more of a bumpy appearance. So it's something that you can also use for that as well. Yeah, there's lots of things I think you can use generally to help your skin, and I think that is one thing that a lot of people are now focusing a little bit on as well. Before, we didn't really focus on doing too much for reducing the signs of aging on the skin, like the more things like bit of redness or hyperpigmentation. Just reducing those will just help to even out your skin tone and make you look younger overall. So I've noticed a lot of people are now doing more things regarding their skin tone, hyperpigmentation. We're focusing more on skin laxity, so that's definitely something you can do both with slightly more invasive procedures or non-invasive ones, whether you're doing surgery or whether you're doing the skin tight. These are all the kind of like available options. So yeah, I think we've come a long way from where we once were. So, you know, if you want to make a transformation for 2025, you're always welcome to come see us. Like, follow, and subscribe. Thank you guys.